By golly, we have a lot of questions for James Geraghty, a resident pharmacist from the Malloy Group. James, you're welcome along to the programme.
Thanks, Paul. Good to see you. Hi, Cormac.
First question, we're a beautiful day today. Of course, we're on
Wonderful,
Facebook as well. So,
yeah.
The difference between sunblock and sun factor.
Yeah, to be honest with you, Paul, we have to be very careful in relation to the sun. And people would often say, and I often go back over it, what are we talking about the sun and what's the damage? And usually what we're looking at here is UVA and UVB, which are the real problems in relation to causing skin damage. And the UVB is the problem when that goes into the deeper subdermal skin. So what we're trying to do then is how do you actually stop the skin from burning? And you'd often hear SPF 15,
Yeah.
SPF 30, 50. And what that means is if it takes your skin, say 20 minutes to start going red, so you put on a skin protectant factor, sun factor, say 15, that means it'll take 15 times longer. So it'll take about, say, 5 hours if you put that cream on to actually get that redness. But that isn't full block. And really what you're looking at full block is between 30 and 50.
Right.
I myself, I use a 30.
You still have a good colour.
I have a good colour, Paul, but I do, you know what I mean? I'm out in the morning, I'm going for a run, I'm down running on the beach and whatever in the morning and stuff like that. But ultimately what you're looking at here is how do you actually protect the skin? Because even on cloudy days you're still going to get these factors or these UVAs and UVBs coming through. And fundamentally at this time of weather, if you look out now, Paul, wonderful blue sky, there's no protection there, the cloud cover is gone, so you're burned very, very quickly. And we in Ireland, we have very low what's called melatonin concentration in the skin, and that's a natural protectant, and we will burn quickly. So it's very, very important there. Go up over 30. That's what I'm saying.
So some of them that might be anxious to get a tan, to look healthy and all that kind of stuff.
Well, tans, you know, I remember years ago, Paul, the big thing was the tan, but you know, you have to be careful. And but if you put on a good sun protectant factor over 30, massage it in, and if you're out in the sun, you know, over a period of time, you will go a naturally bronzer colour. Yeah. But you know,
even healthier.
Healthier colour. I mean, again, we're talking here that the sun is so important in the manufacture of vitamin D. So around this time of weather now, you will get fantastic amounts of vitamin D being manufactured in your skin. So that's really, really important for hormone function. But it's really, really important, and it's one of the things I wanted to say today, Paul, is around the whole area, sunburn, protect. If you are, factor up. If you're unfortunate enough to come across, say, you get a sunburn or whatever, aloe vera is very good. There's a product which I find fantastic. It's called Burnies. I think it should be Burnies. It should be in every household. They use it in intensive care, and it comes either in a gel or it comes in a little bandage that's covered in it. You can put it on, and I've used it for years in relation to treating burns, second-degree burns. But in sunburns especially, and what it does, it stops the blistering. If you can get it on quick enough, it stops the blistering from occurring.
Burnies.
Burnies.
And you get it in the pharmacy.
You get it in any pharmacy. You should do, yeah.
Now, what is the best magnesium to take for leg and feet cramp?
Well, the thing about magnesium is there's a number of forms of it out there, Paul. There's a liquid version, there's tablet, and there's also powder. It's very, very important at times to review what actually works for the person themselves. So if they wanted something to work very, very quickly, either the liquid or the powder would work significantly a lot quicker. And what I'd be looking there, say, is Mag 365. And what people have to realize is that magnesium is what's called a cofactor, and it's involved in about 300 chemical reactions within the body. Wow. So it's very, very important to keep your magnesium levels up.
Okay.
Yeah.
What can you use to remove lines from around the eyes?
That's a tricky one and a good question, Paul. You have to be careful, especially around the eyes, of what you apply to it. What I'd be suggesting there, if somebody has a problem with that if they've called into a pharmacy and maybe have a look at the La Roche-Posay range, there's a number of products in that. But again, you have to be careful what's popped around the eyes. But there are products out there that can actually work, and it would be good to see somebody going in with that particular problem. And what they can do then is just talk to the beautician or talk to the La Roche-Posay rep or the Vichy rep, and they will have something for that.
The lady you had in here a couple of weeks back, she'd be able to advise.
Fantastic.
You, yeah.
Absolutely.
So go to your pharmacy and as we said, ask for recommendation. Now, staying with skin this time, James, what would you recommend for dry, flaky skin?
Dry, flaky skin, the first thing I'd always recommend there, Paul, is something called aqueous cream. It's very, very mild. It's non-allergic in general, and it's very, very safe. And what you can do is, where the skin is dry and flaky, there's two things. You have to work from the inside, so I'd be suggesting there is the omega oils along with hydration, and then from the outside to massage in. Start off with aqueous cream. Massage that into the affected area 3 or 4 times a day. The good thing about that is that there's no steroid or anything like that, so it can be used on an ongoing basis. So ongoing. Now, what I often find is that people will use it for about a week and they'll find good results, but you need to have this ongoing, at least for 2 to 3 months, to really get the hydration back into the skin.
Okay. Now, you asked James, is there anything you could take for I'm feeling a bit down. I don't feel like getting out of bed in the morning. I have a busy work schedule, but things are just getting me down.
Okay, well,
a lot of people would share that.
Yeah, in cases like that, Paul, sometimes I would say 3 things. Number one, to try and get out for 20 or 30 minutes every day for a bit of a walk, a bit of exercise. Number two, to make sure the diet contains at least some sort of slow releasing carbohydrate. And what I mean by that is that they're not getting up in the morning and not having any breakfast, or that they're having too much sugar in the morning, because that can lead to these ups and downs in relation to glucose function within the blood, and that can have a significant impact on how you're feeling. As a supplement, rhodiola is very, very effective. It's very safe, and it's a very simple product here. Rhodiola, I would be very fond of it, even say for example in a seasonal affective disorder. I know I usually take it during the winter months, going right through to March, and I find it absolutely fantastic. And it just gives you that little perk in the morning that you need.
Okay. I got a sore throat 2 weeks ago and have a very bad cough. Was an antibiotics in a cough bottle. I feel something I feel sometimes as if I'm going to smother. Some said it's an allergy cough. Can you help me?
And that person, it could be very right. It could be an allergy cough. And what I would be suggesting there, Paul, is that the person maybe pop into the pharmacy there and get something like an antihistamine. And what that, if the person is still ongoing, if that cough hasn't healed up, on the use of the antihistamines, I'd be going back to the doctor. But you see, because we're around this type of weather, Paul, we are getting the release of these allergens, and that can cause an irritation, especially at the back of the throat, so the cough can be ongoing. So although you may have taken a cough bottle, that mightn't actually suppress it. Yeah, so from that perspective, what we need to do is, okay, is there something else that's causing it? So again, an antihistamine, non-drowsy, for about, say, 2 weeks, and just see how that will go.
Now, a question for James. I have irregular pain, a kind of a ticky tummy for the past month. I'm taking Buscopan and other medications, still recurring out of the blue. What do I do? I have a lot of stress going on in my life at the moment, so a kind of a ticky, irregular tummy.
Okay, well, the important thing to remember here, Paul, is that the brain is directly connected to the tummy via what's called the vagus nerve. So, if you're feeling a little bit stressed or whatever, this butterfly feeling or whatever, can actually impact on the tummy. The fact that they're taking Buscopan, usually what that means is it acts as a settlement, really within the gut, and it depresses the upset in the tummy that sometimes one can feel. What I would suggest there is that maybe that person could go on maybe a small course of pre and probiotics, and because they have a lot going on, what I would suggest possibly is that rhodiola that we were talking about, Paul, maybe for a month or two, just settle the mind.
The tummy is probably as a result of the stress going on.
Well, I would suspect that more than anything else, Paul, because the Buscopan should be easing it down, but if you're getting continuous stress, it's still going to have an ongoing. Yeah, and it'll just settle things down and hopefully just improve how the tummy is feeling.
Okay, my son is age 17. He sweats a lot. His t-shirt looks like it's continually wet. What can I do to help him with the problem?
Very common in teenagers, very common in young men. Usually what I recommend there, if you pop into a health food store, there's these little organic sweat blocks you can get that you can just, especially for underneath the arm. You have to remember that the sweat glands open up, Paul, because the body is slightly overheating. So it's the body's own way of regulating heat. What I would suggest there, if there is a lot of sweating going on or perspiration, usually what you'd recommend there is to take some extra electrolytes, because you can be using a lot of sodium and potassium or losing that out of the system. So in that case, I definitely getting some sodium and potassium into you using, say for example, a diurolite. But definitely, again, get these little organic sticks. They're little blocks that you can actually use, which are really, really good at just easing down, especially underneath the oxters and down around the feet.
Okay, just before we take a break, I have no smell or taste after a sinus infection. I got the flu as well after Christmas. I was on steroids and a nasal spray for the sinus. Is there any advice you can give me? So no smell or no taste after a sinus infection.
Okay, well, usually what that means is that the receptors in the nasal area, Paul, are pretty blocked up and they're basically not working. Usually what I recommend there is, it's what's happened is the mucus coating sometimes goes across the receptor, and what we have found, if you use a saline spray, it can be really, really effective because it acts as what's called a demuculant. And what that actually means is, it basically, if there is mucus that is basically stuck on the receptor, it'll actually clear it away over a period of time, but you need to use it about 3 or 4 times a day for about a week.
Okay.
Okay.
Right, we're going to take a quick break. Kelly Truck Time here on Midwest Radio. It is 12:41. Now, James, a million questions to try and get to. I have an awful pain in the ball of my foot. I walk a lot every day. Can you help me?
It possibly could be gout, Paul, or else it could be a strain on the outside of the foot. And sometimes the pain in that has to be looked at by either a podiatrist or a physiotherapist, I'll be saying, Paul. You know, it's really, really important because I have a number of people that have come in with that symptom, they've let it go, and what happens is it starts to impact on their knees, it starts to impact on their lower back, and fundamentally you can end up then with a very, very impaired walk. So usually what I'd be recommending there definitely would be some anti-inflammatories. Pop into your pharmacist and just have a chat with them there.
Right.
And then, you know what I mean, to be talking to the podiatrist in relation to maybe getting you can get a set of inserts fixed for your shoes. If that's not working, then you know you have to be really considering making sure that ongoing, you know, that it doesn't kind of turn into a chronic problem.
Okay. Now, can you help me? As I continually suffer with a constant frog in my throat, also with hoarseness. I take Nexium twice a day, but the frog in my throat impedes my singing. So obviously they might make a living from singing.
Yeah, that's a very good question, Paul. And there's a lot of angles you could really look at it from that. I mean, one of the things is, first of all, is it a side effect of the medication? Is there some acid coming back into the throat at night? I'd love to know what dosage they're actually on there, and maybe it'd be better.
Twice a day next
Twice a day, okay. And it's, what strength did they say, Paul? Is it 20?
Didn't say.
Okay.
Didn't say.
It may be worth, Paul, maybe just taking the morning dose maybe a little bit later on in the day. Say rather than taking it, say 9 o'clock, maybe taking it about 1 or 2 o'clock, and then taking the other one maybe a little bit later in the evening time, just to stop acid production in the tummy. What I would suggest there, though, is maybe if they got an opportunity, maybe to take some propolis cough bottle is very, very effective. Yeah, propolis cough bottle. If they call the propolis, they get it in any of our stores, Paul. It's very effective at that frog in the throat type symptom.
Now, this is a question I'm giving to you as it came in. Hi, James. Any cure for midgets taking Periton, but I'm covered in bites?
Okay.
What do you mean by that?
Well, I'll tell you what, Paul. So, for some reason, you know, if you're out in the bog on a late evening, evening, and the guys start coming at you, that's the midges, and they can be really they seem.
Oh, I'm scratching already.
I
see you were scratching.
I am, Paul, a little bit, because I remember many years ago in the bogs of Roscommon making up the footings of turf, and I can tell you I had my fair share of them. But in saying that, Paul, purely from a clinical perspective, what's happening here is, you know, these midges, they're coming in, they're lying on the skin, they're irritating the skin. And what happens is you get histamine release, and it causes that real irritation. And some people react very badly to them. But what we have come across, if you get a little bit of citronella essential oil, that's citronella essential oil, and just put it on around the hand area so that it sends off an odor. It's not that bad, but apparently the midges really dislike it. And if you take something like that along with vitamin B complex, if you're really struggling with them, vitamin B complex along with citronella. Citronella, it's an essential oil, but it seems to repel them. It acts as a natural repellent. And I found that over the years that has worked really, really well.
And you get that in the pharmacy?
Absolutely, yeah.
Okay, now, should a vegetarian take B12 supplement?
Yes. The fact that a lot of vegetarians wouldn't, obviously, by the fact that they're vegetarian, they won't be taking meat, and there's a lot of vitamin B12, and vitamin B12 is very, very important. Number one, as a cofactor within the body, Paul, and it's also important purely from the fact that it is what's called an intrinsic factor.
Right.
You can either take it as an oral supplement, as a liquid, and there is a vitamin, I'm sure there's vitamin cytocon, vitamin B12 tablets. Their impact isn't as good as the B12 injection, and that's given by your GP. Right. So usually if you're feeling, if your B12s are down, which are usually identified by the bloods that the doctor will bring back to you, they'll usually put you on injection over a period of a couple of months, and that usually brings them back up.
Okay.
But the important thing here is the continuity. Usually you get the injection every week or every 2 weeks. You have to get them in because the absorption rate taking it orally isn't as great as given by injection. Okay.
What would you recommend for frozen shoulder? It's very painful.
Yeah. I to be honest with you, Paul, I had that about a year ago. I was doing an awful lot of swimming front crawl, and he ended up with it, and I was just terribly sore. But I'll tell you what I did, Paul. I went back to my physio, and he gave me a couple of exercises, and again, it's all about the discipline of trying to do them. But after a period of time and some anti-inflammatories, it worked out really well. But the trick of not getting it again is to basically to work on the shoulder, especially on the back muscles that support the upper shoulder area. And by working on them, it keeps the actual shoulders, rather than from rounding, if you're sitting in, Paul, at a desk, it keeps them pulled back a little bit, and that really helps in frozen shoulder.
Okay. Hello Midwest. I suffer with arthritis in my fingers. I now have gout in my foot. It's very painful. Can you ask James, can I take something, can I get something across the counter to ease the pain?
Well, in a case like that, if they have arthritis and they're suffering, is it gout as well, Paul?
Gout as well, yeah.
Yeah, I mean, most obviously have been to the doctor, and usually to be on medication there, different types of medication for pain, Paul. But usually in something like this, what you would be recommending is an anti-inflammatory just for short-term pain relief. And even at that, Paul, the over-the-counter medications, especially if the arthritis is really bad or the gout is really bad, that usually needs prescription-only medications, and you'll be referring to the doctor in that case.
Go back to the doctor, right?
Yeah.
There's bad news for someone, I'm afraid, but it's gout is very
really
common
sore.
here.
I got one dose of it in my life.
Never had it,
and
thankfully.
It was really crippled me.
And there's no real, there's some relief for it. What's the best relief for gout?
The best relief I have found in a prophylactic nature. What I mean by that, Paul, is how do you stop it coming back? Is to modify the diet.
Right.
To avoid alcohol as much as possible and avoid red meat, because there's this thing called purines in it, and it's amazing from a chemical point of view how it works, because if you get too much of them into the system, they crystallize out. So actually they start to crystallize in the extremities, so they start falling out of the blood and they start crystallizing, so you get this terrible pain. It's like a glass shard within the feet or within the finger area.
Now, what would James' advice be for a teenager who suffers from acne?
Acne, usually very common, and again we're looking here at the whole area of hormones. Teenagers are changing, the bodies are changing, so the skin sometimes comes under a bit of pressure. What I always recommend is into the chemist or into the health food store. There are a number of creams out there that are very, very effective at easing down the issues surrounding acne, wasn't it, Paul?
Yeah, acne.
Yeah, surrounding the whole acne area. But on the basis of it not actually working, Paul, or diet and issues like that need to be looked at, there are a number of creams and topical ointments as well that can have a significant impact on acne, and the capsules themselves are quite effective in easing down any infection that's underneath the skin that can bring it on. But where acne is involved, I usually refer to the GP.
Okay. I've had a sinus infection. It's cleared now, but my ear is deaf and it's buzzing.
Okay, well, depending on their age and depending that they're not on any other medication, I'd always recommend to drop a Sudafed 3 times a day, a spoon of Sudafed 3 times a day, the liquid, for about 4 or 5 days, because sometimes you can end up with a little block in the ear. Yeah. And I find the Sudafed is absolutely fantastic at just clearing up that blocking.
Okay. Now, I've been told I have fat on my liver. What exactly does that mean?
Well, that depends. Sometimes you get this thing called fatty liver, Paul. It's where the body itself actually deposits deposit fatty complexes in or around the liver area. It needs to be washed. Usually the GP would have a good handle on it. It usually comes back in relation to bloods again that the GP would have done. As long as it's watched, and as long as the diet and the medication is watched, there's usually no problem. But again, this is under a doctor's supervision, per se.
A man in his 50s, he's not very active, but he does a lot of sitting. He needs heat 24 hours a day, even though he's continuously sweating. He isn't on any type of medication, so he's active. He's not very active. He just has to sit a lot, but he, as you said, 24 hours a day, he needs heat, even though he's sweating.
Yeah, that's unusual. Paul,
strange one.
You'd have to say. And usually now I'd be putting myself as a pharmacist in the store, and if somebody was coming in and mentioning that to me, I'd be recommending there to pop to the GP, just have an overall check.
Yeah.
Especially, I suspect if I was talking to that gentleman, he'd be saying, I haven't been to the doctor in a long time.
Yeah.
I think it'd be important there just
Get an MOT.
just to get the MOT done and get everything double checked.
Oh, if in doubt, as we say, check it out.
Yes.
A lady has an accident recently and got stitches in her face. She wants to know what kind of cream she'd use to minimise the scarring afterwards.
Okay, there's a particular one called that I have used, depending on where the scar is, Paul. There's a particular one called Bio Oil. And, I remember actually I was talking to a lovely lady down in Acne recently, and she had something similar, and she recommended a new scar gel, I think it was called. You know what, the name actually escapes me, but I'll tell you what I'll do. I'll get the name of it, so I will.
Give it out tomorrow,
will give it out. Okay. We'll send it in, guys, and maybe Cormac can help us put it up on the web or something like that.
Right. What's the name of the oil again for the midges, as I call them? What's the name of the
Citronella.
Citronella.
Yeah.
Okay, I'm embarrassed to go into the pharmacy, but is there any over-the-counter alternative to Viagra?
Yes, you can pop into a health food store. I'm sure we have it within ours. It's called Prelux.
Prelux?
Yeah, Prelux, yeah.
Is it the same?
It's quite similar, and a lot of men have had a lot of success with it, Paul. Okay. But the only thing I would suggest is that you take it maybe half an hour before the act.
Right, jiggy, as we say.
Well,
could James repeat the cream he mentioned about sunburn? Go on. Could you repeat the cream he mentioned about sunburn? Can't remember. Jiggy as you put on.
Which there, Paul? Just run that by me. I'm so sorry. You're not confused there.
Okay, could you repeat the cream you mentioned about sunburn? Remember sunblock?
Yes, the Bernese gel. Yeah, well, the Bernese gel is for the healing of the cream.
Sunburn, yeah. Bernese, yeah.
Bernese. And what we're saying, we mentioned what we did, Paul, is, full block, you need to be going over 30 to 50.
Right.
And if you do succumb to sunburn or you get any irritation or anything like that, I find personally Bernese gel is absolutely brilliant. But aloe vera I find aloe vera very, very good as well. But the Bernese, if you get it on as soon as possible.
That Bernese is not just for sunburn, it's for burns.
Oh no, it's for burns.
It should be in the house anyway.
I think it's one of the best products I've ever come across in the pharmacy, Paul.
Okay, right.
It's really good.
And again, getting back to the B12, how high should your B12 be?
That depends, Paul. It depends, number one, on your age, whether you're male or female or what have you. But once you get your bloods done, there's a marker between where vitamin B12 should fall. Okay. You won't know that from a pharmacy. You got to get your bloods done, and once you have your results, it'll tell you whether you're positive or negative.
Last question in 30 seconds. I got a pain in my ankle inside of the foot. If I walk or step, I can hardly move. With pain, this is a pain in their ankle. Yeah. But after a few days it goes away. This is going on for months. Should I see the doctor?
I think so. Absolutely, Paul. And if they can't get to the doctor, they have to see the physio on something like that. Okay. I mean, they could have had a fall, they could have a little fracture going on there, or a little break in the bone. It needs to be checked. Okay, James, thank you very much. You can view all this on Facebook. By the way, if you didn't get it on, it'll be up on our Facebook site later on Midwest Radio's Facebook. Thank you very much, James. You, Paul. Thank you. There you are. That's James Geraghty from Malloy's. That's what we're going to leave for today. Back, God willing, in the morning. Jerry will be with you from JJ Burke Car Sales in Ballinrobe. But from all of us on the Mid-Morning Show, God bless. Take care.